Well, ask anyone with serious chronic back problems and they'll tell you their life revolves around that pain. It dictates what they can and cannot do, from simple chores to everyday events. So today I sit down with a doctor who says he can help patients get back to a life without pain with his revolutionary procedure. And joining me today, we have neurosurgeon Dr. Abbasi with us. He is with Inspired Spine Surgeons. It is so good to have you with us, doctor.
It's a pleasure to be with you.
Yeah, let's kick it right off. We've got a lot of people, I'm sure, watching that have back pain. So many Americans living with that every day. So you have this spinal procedure. You describe it as minimally invasive. So just give us the lowdown. How does it work?
Well, first of all, the spine problem is such a common problem, as you just mentioned. As a matter of fact, by the time you're 70 years old, if you have never had spine problem, you're among 1 to 2% of the population. And it is actually numbers 2 the reason for disability in the United States. So it has huge impact. And treating them old-fashioned way, for short of other terms, is extremely invasive, devastating to the patient, and causes lots of time to recover from the procedure itself. And we made a procedure that they removes all the invasiveness, all the cutting part, all the blood loss, all the creating dead tissue, and make that go away, so patient can get the benefit of the surgery without the devastating part of the surgery itself.
Right, they're often afraid, right, of having that big scar, of having to take so much time off of work. And so who is a good candidate then? Are there patients that, maybe they've had problems for years and they feel like, there's nothing out there that can help them? Are they a good candidate?
Everybody who has a spine-related pain is a good candidate to look into the options. And I think that is what I love about the internet and the communication and the way we get the information these days, that these informations are all out there for the patient to have. And if you have a spine problem, and if you have been told that you need a surgery, look into your option and compare it. Listen to people who have gone through different processes. In many cases, people who are told by major hospitals that they need a 2-day surgery, 2 years recovery, we do 1-hour surgery, send them home next day, and within a month, we put them back on their previous life, something that open surgery is unable to achieve.
And in fact, you have had patients up and walking maybe 2 hours after surgery, which just sounds almost too good to be true. And what do you say to people about that as far as that being a common, occurrence?
Well, the reason people after spine surgery cannot walk usually in average for 2 days is because we cut those muscles that people use in their spine to walk with. And what we do, we just don't cut those muscles. So that is very inherently makes sense that if we don't cut those muscles, we dilate them with a tube that is barely thicker than this pen. And by doing the surgery through that the tube and not cutting the muscle, right after the surgery, patient can use them. That's why they are able to walk right away.
And doctor, you have had so much success. Patients from all over the world seek you out. And there are also a lot of other doctors coming to you to try to learn this technique and this procedure, correct?
As a matter of fact, we built a center campus. We call it the campus. And we are one of very few private institutions that put lots of effort to teach this free of cost to other surgeons, because this is such a common thing that this impacts our society, our healthcare, our economical. People who have to live toward the end of their life, in the last, when they are in 70s and 80s, and they need so much help from their family to just survive. We make them independent. So this is, we have to do that. This would be unethical from us, keep it just for ourselves. That's why we created a educational facility here in Minnesota. And we made it in Minnesota that people don't come here for weather and vacation. If they come here, they just come to learn. Right now we have -30. So if they come here, they come to learn this and give it to their patients. So we have put a lot of effort to pass it on.
And we want our viewers to learn more about that, especially if they're living with back pain. So inspiredspine.com, a great website to start with. You can see all of it there and get in contact, of course, with Dr. Abbasi and his team. Thank you so much for being with us today.
My pleasure, Robin.